I'm Dr. Ashutosh Marwah. I'm Senior Pediatric Cardiologist at Apollo Indraprasth Hospital, New Delhi. Today I will be talking about congenital heart diseases in children. Incidence of congenital heart diseases is roughly about 1%, which means in India, every year 2 to 2.5 lakh children are born with heart defects. These defects can be mild or can be severe. The mild varieties often do not need anything except for periodic monitoring. What we are looking at is that either the disease has healed or it has not led to any complications. Whereas severe varieties of conditions may require treatment at birth or very early in life. Majority of treatment can be done by surgery or by non-surgical procedures in cath lab. Very often we find parents who are interested in knowing whether their child has a heart disease or how to pick up whether the child has a heart disease. So as I said, there are milder varieties which often are not detectable easily because child is usually growing well, the eating is normal, the weight gain is normal, there is no restriction in activity. These kind of defects can be picked up only by the pediatrician or a child specialist when they put a stethoscope onto their heart and find any abnormal sound. Whereas if the child has a severe variety of heart condition, then very often we will find that these children do not take milk properly, they get tired very easily, or when they are feeding, they are excessively sweaty or breathless. Sometimes there may be mixing of clean and the bad blood, so these children can have low oxygen saturation and in turn their lips and nails may turn blue. Severe variety of disease conditions often cause significant growth failure. Very often these children suffer from repeated respiratory tract infections and require hospitalization. Severe variety of conditions, if not treated on time, can cause increased mortality or morbidity of these children. For milder variety of cardiac conditions, most children do not require any specific treatment except they need to have good oral hygiene, and whenever they have any dental procedure, they should be provided with appropriate antibiotic cover. It's important to find out whether the child is suffering from a mild variety or a significant variety of heart condition. So echocardiography is important. Echocardiography done by a pediatric trained person will be able to detect whether this condition is mild or requires any treatment. If the child suffers from mild condition, most often these children will not require any medications. Only thing they need to be provided is adequate, appropriate dental care, and if they require any dental procedure, they should be provided with antibiotics before the procedure. Whereas if the child suffers from significant cardiac condition or a severe variety of cardiac condition, these children should be taken to treatment which may be surgical or non-surgical as guided by your pediatric cardiologist, because very often these conditions become inoperable if not treated on time, which can be as early as 6 to 9 months. So treatment on time is the key for long-term good outcome.